Hello everyone, and thank you for joining our Sleep Science Friday. Our guest today is Professor Brigitte Holzinger, who is the director of the Institute for Consciousness and Dream Research in Wien. Professor Holzinger is a psychologist, and one of the techniques she uses in her practice is an integrative Gestalt therapy approach. Today, we will talk about Gestalt therapy in sleep field. Hello, Professor Holzinger.
Hello, Ludmila. Always a pleasure to see you.
Thank you. It's a pleasure to see you too. Please, could you explain in simple words what Gestalt therapy is and how it works?
Well, I'm a little nervous today because that question exactly is very difficult to be answered. Gestalt therapy is a very creative approach. Some say it's the most artsy approach amongst the psychotherapeutic techniques. And it has several routes. One route is, of course, psychoanalysis. So some call it a depth psychology approach. And another route would be Gestalt psychology, Gestalt theory, which is the old German approach to perception psychology. And it was an early attempt around 1920 to assess how perception is something that we need to learn. Also, we are born with the potential, but we have to then fill that potential with experience, so to say, and from that we are forming what we call, what Gestalt theorists call a Weltsicht, a sort of the perception of how to see the world, so to say. And that's another route of Gestalt therapy. Gestalt therapy is, in that sense, very integrative because it allows for hard data science as the research on how perception, for instance, works is considered, of course, very valuable and revealing also for psychotherapy. On the one hand, on the other hand, the phenomenology, also the observation of perception, for instance, also is as important as the physiological approach. And these two approaches are called, have a name in Gestalt theory. One is called the phenomenological approach, sorry, and the other one is called the physiological approach. And they are considered equally important. That was very important for me when I first studied psychology, because to me, both is very important as well. And I had the feeling early on when I was a student that one had to make a decision whether one wanted to be a natural scientist or whether one wanted to be a humanistic scientist. And that's what Gestalt approaches combine, and what drew me to Gestalt when I started out. So in terms of how to work with your clients, I tried to make a list of what is important in Gestalt therapy. I said it is based on perception. So one thing that's very important is in Gestalt therapy is the so-called awareness. The awareness of the client, but also of the therapist. And to kind of try to train or extend your ability of being aware. You try at least as a therapist. And you are not abstinent as you would be in psychoanalysis. You can say what you think, I mean, to some extent at least as a therapist. So the approach of authenticity of the therapist and the client is very important. So it's much more important for the Gestalt therapist to be authentic and in contact, hopefully with oneself and with your client, than to be abstinent, like you would be in depth psychology. So in order to provide the therapist-client relationship or contact, and that's actually considered the most important tool in Gestalt therapy, to become more authentic for the client through the relationship with your Gestalt therapist. Gestalt therapy also has the so-called 3 E's. It's what it means is it's an experiential approach, experiencing whatever it is that your hang-up is, so to say, is more important than analyzing it. It's an existentialistic approach. It's about your existence in the so-called here and now. So that means that, yes, of course, the past can play a role in therapy. The future can play a role in therapy. But what's most important is the here and now in the existence of the client, so to say. And it's an experimental approach. So you can, as a therapist, inspire your client for experiments in the sense of trying something new or a behavior that you don't dare try it as an experiment, so to say. How do you feel when you experiment, say, with speaking up, for instance? And also very important in Gestalt therapy is the emotions, much more important than your thoughts, because the thoughts are considered emerging from your emotions, so to say. But also your emotions steer you to have good thoughts or productive thoughts or destructive thoughts, for instance. Of course, we speak to our clients, so we use thoughts as well in therapy, but it is considered that the most important drive would be the emotions, the feelings, we say. It's also called, Gestalt therapy is also called the therapy of emotions or the therapy of feelings. So,
Holzinger, one question. You mentioned that this is a very creative approach. Does it mean that both the specialist, the psychologist, and the client need to be creative people or have creativity? What do you mean by this?
Thank you for this good question. Of course, it's a bit pretentious to say Gestalt therapy is very creative. But let me explain. In the early Gestalt theoretical circles, creativity from the beginning was considered something very healthy. So we are kind of aiming for becoming more creative. And at the same time, everybody is considered in its core from birth on, so to say, as a creative being, also the client and the therapist. And the therapy is also about discovering and finding and unfolding your own creativity. And it doesn't mean that you have to become an artist. Creativity can be found in everything you do about life. I mean, cooking is very creative, for instance. And also how you get in contact with somebody can be very creative. and of course, overcoming some psychological obstacles, say, is a very creative process, at least according to the Gestalt therapy.
Thank you. If talking about sleep and sleep field, I have heard that the founder of Gestalt therapy, Fritz Perls, said that behind any trouble in sleep, there is a problem which needs to be solved. So, with regard to this, how does Gestalt therapy help people with sleep problems, and which sleep disorders are in the focus of Gestalt therapy?
Thank you for mentioning that. And I mean, Fritz Perls was a very educated, we call in German, Bildungsbürger. He himself was an MD, I think a psychiatrist, but interested in the arts very much. But sometimes he was a little bit too simplistic. And I think that sentence is also a little bit too simplistic. On the other hand, what it implies is another way of seeing psychological processes of Gestalt as well, which is that there is a foreground and a background of perception, but also of a psychological challenge, say. And considering and say an insomnia, also not being able to sleep, translated into that kind of, as an expression of a personal situation of a human being. In the background, at least, and in the foreground would be the symptom, not being able to sleep. So in the world of treating sleep problems and sleep disorders, I think that combining what we already know to be very helpful and proven, the cognitive behavioral therapy or treatment for insomnia, with Gestalt, I think is a fantastic combination, because I think that the CBTI is able to treat the symptom, the expression itself, not being able to sleep, and the Gestalt approach then is looking at the background, meaning the situation of a human being that brought him or her into that situation, for instance. And it is also kind of working hand in hand, because it could be viewed as a Gestalt approach to advise and somebody who cannot sleep to try something creative, so to say, when one cannot sleep, for instance. And it's an overlap, of course, to the CBTI, where you have the Grübelstuhl, for instance, also, or you're writing down your thoughts that are going through your head, so to say, while you can sleep. That could be considered a creative process as well, depending on what one does with it. So I think that, for instance, could be an overlap between CBTI, say, and Gestalt. And there are quite a few overlaps in general between behavioral aspects, as they are also actually quite existential, could be viewed as an existential approach, dealing with the here and now of a person's situation, and as is the Gestalt approach, an existential approach, dealing with the here and now, for instance. So it is insomnia, or I would say some kinds of insomnia, that would be could be approached with Gestalt therapy, Gestalt techniques, and of course nightmares and nightmare disorder is another sleep disorder that could be approached with Gestalt therapy. And then, of course, dreams and dream work, if one would consider that belonging to sleep research, which of course I do.
So you usually combine both CBT and Gestalt therapy in treating insomnia and other disorders. And so this is like add-on therapies to each other, increasing the power of psychological approaches in treating sleep disorders. Yeah.
And that is the core of what we have developed, what has sort of, I would think, developed by itself more or less, the sleep coaching. I think we talked about that last time.
Yeah.
That's sort of the basic understanding of the sleep coaching, integrating powerful approaches for the sake of our clients. Other approaches in the psychotherapeutic world, which is a tool stemming from Gestalt therapy, is the so-called role play or two-chair method. And that can be, in my experience, very effective also for treating insomnia, but certainly for conducting dream work. That, of course, would be a new topic in itself, because there would be many topics and many things to be discussed beforehand, before one could go into that deeper. But that's something that's known as a Gestalt technique outside of the Gestalt world usually as well. The two-chair method or the role play.
So not only in Gestalt therapy, but also in other psychological approaches.
This has been taken from Gestalt therapy and been introduced also, say, in behavioral therapy settings, for instance. And Gestalt therapy is a very integrative therapeutic method.
But I think that any approach, any technique has some limitations. And what are the boundaries for Gestalt therapy in general, and maybe in sleep, some knowledge fields in particular?
Yeah, also Gestalt coaching or Gestalt therapy kind of seems not to be a quick fix, so to say. So we also consider healing, if you wish, if you want to use that word, as a process of development, and the process can take some time. So I think that could be considered a limitation of Gestalt therapy, that we cannot guarantee that, I don't know, in 5 sessions you have overcome, say, the insomnia problem that the client comes with, so to say. And we look at overcoming troubles which could be considered insomnia as a process, and for every human being and in a specific situation, the process might take the time it takes.
So it's usually unpredictable how long it takes in certain person to achieve the goal, to get the effect, to heal.
Well, we hope that some changes are happening rather quickly to encourage the person to trust in the process, so to say. But it is hard to describe or hard to promise that, I don't know, in 5 sessions you will sleep well already, say. So it's not something that is tailored for a short period of time. Another limitation is that it's very difficult to do research about Gestalt therapy, even though luckily more and more research is being done, it's usually about the effectiveness rather than certain kinds of Gestalt approaches. But this type of research now has taken on, luckily, and I know that Gestalt therapists are eager to conduct research projects more and more. And I welcome this very much, because we need to go deeper into it and see what can be proven as being effective and helpful. Of course.
It's an important point, I think, for any researcher, and especially for those who are in psychological field. And with regard to this, I think for anyone who is starting to use a new technique, it's always a bit it causes some anxiety or some kind of anxious thoughts. What would be your recommendation or advice for a specialist who's just starting to use Gestalt therapy approach in his practice? What would you recommend to develop better in the field?
Well, I would say for Gestalt, it is a good idea to having been trained thoroughly. But if you have been trained thoroughly, and if you have your clinical experience, which I think for therapists is crucial, and also for, of course, a Gestalt therapist is crucial, then it's a good idea to emphasize on trusting the process, and therefore using one's own courage and also hopefully creativity, daring to use your creativity, daring to experience the so-called dialogue with your client, and how it can be very helpful. I think finding the joy in what one does and finding out what are your own talents that you bring to the therapeutic table and develop those. I think that's a good start when you start out as a Gestalt therapist.
Thank you for this recommendation. And maybe last but not least, what would be your advice for people who have trouble in sleeping, who have sleep difficulties? As a Gestalt therapist, what would you recommend?
Well, as a Gestalt therapist, as Gestalt is very integrative, look around and try to see what speaks to you as advice for dealing or for healing your insomnia or your trouble sleeping. And also remember your own creativity to choose what it is that you would like to apply first. So I think that is an advice to start out with. And I would also recommend that in the same vein, on the same manner, look for the right therapist for yourself, who would be able to help you develop your own potential, also as a sleeper.
Thank you very much. That's also very important advice. And dear Professor Holzinger, thank you very much for this amazing discussion and talk about Gestalt therapy, which I think will be very helpful and useful for all our listeners.